There was a question regarding a patient with a spondylolisthesis and severely arthritic facets as to whether they would potentially benefit from going for what's called a medial branch block or an MBB prior to potentially discussing surgery. It's a really good question. Medial branch blocks are good for facetogenic pain. They undergo a block first of the nerve extending from the exiting larger nerve root that goes up to the facet, and then if they note 70+% reduction in pain, then they can undergo what's called an ablation, where they actually ablate the nerve, and that usually lasts for 6 months. That nerve can regrow itself. However, in these instances where there's dynamic instability and there's motion of greater than about 3 millimeters of anterior to posterior movement of the vertebral body of L4 on L5, the utility of that facet block might not be great. And they might not yield significant improvement because there's dynamic instability. However, in the setting of no dynamic instability, I would say a medial branch block is a great next step for this patient, as long as they don't have severe radiculopathy or pain radiating down the legs. A medial branch block is probably not going to give significant reduction in the radiculopathic symptoms. A medial branch block would work better at the facetogenic pain or the back pain that does not extend into the legs.